Thanks for tuning into this clip. Loneliness and working together to reduce loneliness. My name's Ed Seipler, and I work in health development in the Southeastern Health and Social Care Trust. Now, I've been working along with the Loneliness Steering Group, and they're working really hard this year to not only raise awareness of loneliness, but also then move toward what we all can do to help. Now, loneliness, why we're doing this, and this is powerful. It can really damage your well being and health. Loneliness can be as harmful as smoking 16 cigarettes a day. Whoa, I heard that and I went, that sounds pretty serious. And it also increased the likelihood of dementia by 64%. And chronic lonely people are much more likely to experience anxiety and depression. Hmm. Now, what is loneliness? It's less about the numbers of friends and people you have around you. Well, no, some people enjoy being alone, while others, they can be part of a social group, a big group, and they still feel isolated and alone. And being socially isolated and loneliness are two very different things. Social isolation, what's about the quality and quantity of your relationships with other people at different levels, at work, at home, your community, school. But loneliness is very different. It's an emotional perception that people experience regardless of their breadth of social interactions. Now, is it always a problem? Well, it's normal for people to feel left out and lonely sometimes. Most of us will feel lonely from time to time, but it's a problem if such feelings persist and they take over. And in our trust, Southeastern Trust, 14 to 19% of people across our trust area are experiencing loneliness. Now, if we look closer at loneliness, people who describe their feelings and thoughts of loneliness, well, they use words like anxiety, fear, helplessness. These are powerful emotions, and they can influence how we act. They can create a downhill spiral where loneliness causes us to withdraw and we pull inward from family, friends. And you might notice your mood fluctuate. People describe that like an emotional roller coaster, where out of the blue, you can just plummet with sadness or irritability. And that can be unprovoked. And that can really leave you feeling confused and emotionally drained. So if we look at feelings, well, the Campaign for Loneliness, they put their finger on a whole range of feelings that people who are, chronically lonely feel. And look at those feelings. They're powerful. Distress, those painful feelings of anxiety, helplessness, emptiness, abandoned, not feeling understood, lost, sadness. Those are really powerful emotions. And when we drill down into the psychology of loneliness, what we know, there are some risk factors, and the list is pretty long, but there are some things like living alone, poor health, poor mobility, economic problems if you have some poverty going on, life events, any transitions in your life, big changes can be a risk factor. Being a carer, you have a caring responsibility that can add to the burden. It can help make people feel lonely. Domestic violence, and there's a long list of other things. And when we think about loneliness, it's just not older people who feel loneliness. 18% of 16 to 24-year-olds also feel lonely. Now, we talked about that downhill spiral. Loneliness can make you anticipate and interpret social situations very differently. You can be sensitive to social rejection cues. You feel like you're a burden. You don't trust people. You pull inward. And that downhill spiral, loneliness can lead to a lack of confidence, makes you withdraw that a little bit more. That can set off a downhill spiral where more negative thoughts and despair creep in. And if left unchecked, it can lead to chronic loneliness. And when it's at that level, chronic level, it's harder to treat, it's harder to tackle. So if we look a bit deeper into how loneliness affects us all in our bodies, studies have shown loneliness can change the way the brain works. It lowers the ability in the regions of the brain to play a big part in thinking, but it also heightens activity in regions in the brain associated with negative, unhelpful thinking. Okay. Well, if if we look at then our mental health and well-being, if loneliness can lead to depression and social anxiety, well, here's a question: does alleviating one have an effect on the other? And less social participation, you're less engaged with other people. Well, that's going to leave you less stimulation cognitively with your thinking, but also your sensory stimulation. Now, What we all need to address this, here's one word: our agency. Now, what does that mean? Agency is you deciding what will work for you, supporting your well being. And it is the most significant factor of supporting anybody's well being. We learned that through COVID. And as Martin Seligman from the University of Pennsylvania says, agency has three parts: self efficacy, that belief in your ability, I can do this; optimism, that hope, if I do this, it's going to be helpful; and you're active in choosing it. So it's an active process. You actively choose what's going to support your well being. Now, the steering group, who's working really hard across the trust, will be meeting to work on mapping opportunities to help people just engage and feel less lonely. And they're going to work on training so we're more aware of the impact of loneliness and what we can do about it, and also establish champions. But what can we start using right now? And maybe it's a good time to talk about this, as coming up is Loneliness Awareness Week. Well, if the psychology of loneliness is telling us those psychological factors have a part to play in us understanding loneliness, well, that raises the question: what psychological techniques could be helpful to help people who are feeling a bit lonely? Now, we have two resources that can help: self-compassion and Bend Don't Break, which is a low intensity self-help booklet. I'd like to talk about both of them. Now, with self-compassion, how hard do we tend to be on ourselves? We tend to beat ourselves up. You make a mistake, that self-criticism is consistent. Now, we all want to belong, but how many times do we compare ourselves to other people? And self-compassion, well, that helps us be our own best friend. Now, self-compassion has three parts. It is the way we talk to ourselves. You talk to yourself like you would a good friend. There's no way you'd say to a good friend who's making a mistake or is struggling the same things we say to ourselves. So we learn a language of self-kindness. You also recognize the difficulties, mistakes, bad decisions, and well, that's part of the human experience. We all have those: make bad decisions, make mistakes. Doesn't make you a bad person, makes you human. And we're able, third part of self-compassion, we're able to observe our emotions in the here and now and use mindfulness, focus on one thing to bring ourselves back to the present. Full circle to the first one, non-judgmentally. And I like that quote by Chris Germer: a moment of self-compassion can change your entire day. A string of such moments can change the course of your life. Now, it's just not warm and fluffy. It's based on science. Now, two leaders in self-compassion, Chris Germer and Christian Neff, well, they're clinical psychologists, and they were greatly influenced by the work of Paul Gilbert, who is behind compassion-focused therapy. And out there are over 1,600 articles on self-compassion showing the benefits of it. Now, what does it do for people? It helps improve the compassion we have for ourselves. It lowers the depression, anxiety, stress, and emotional avoidance. That's important. And if it can increase our social connectedness, we feel more connected, we're going to get more satisfaction out of life and happiness. And those gains, they can be maintained. And this is an important statement: the link, there's a strong link between that benefit you're going to get and the amount you practice it. You practice and you build self-compassion into your daily life. So to help people do that, we've developed a booklet to introduce you to self-compassion. This could be useful for anyone, but we particularly think it could be exceptionally helpful for people who experience loneliness. And it has a description of self-compassion, some tools to get started. You got to be a bit careful, because if you've been beating yourself up for a long time, you got to be careful of what they call backdraft. That's a firefighting term. And think about a fire that's starved of oxygen. If you've been starved of positive comments towards yourself, well, it's like backdraft to the fire. You let oxygen in, the fire flares up. What do firefighters do when they see backdraft? They poke a hole in the door. They'll break a window. They'll let the air in slowly. So in the booklet, we have 8 self-compassion exercises to help you get started. Now, your thinking could also play a part. Now, we all have that negativity bias. That's normal. It's human. We tend to see the bad before the worst. But if that part of our brain increases that negative thinking, well, the same old thinking, we're going to get the same old results. And one way to think about dealing with those strong emotions that we have in life and we have with stress, but we also have in loneliness, well, we can use RAIN. RAIN is an acronym. to practice self-compassion and what's in bend don't break when those strong emotions do come up. And it's simple. Now, simple doesn't mean easy. The R stands for recognize your emotion. Don't try to push them away. Just notice them, name them. And the second step, A, that's to acknowledge them. It's a move on from the first. You accept the feeling as is. You allow it to be there. You give yourself permission to feel it. Think about the step to self-compassion. This is the entry into self-compassion. And the I stands for investigate. Then you get curious. You work on your thinking. You ask questions. Where's this feeling coming from? What's going on here? What choice do I have? You explore it with openness and curiosity, not judgment. And non-identity, these feelings are going to pass. It's your thinking that keeps it going. So we are more than just our feelings. Feelings are temporary. Now, to help us do that and help us learn these skills of challenging our thinking, we have another self-help resource, Bend Don't Break, which helps people look at more resilient thinking. But like self-compassion, it's the amount you use it that's going to link to the benefits you get. So to help you do that, what we've created for both resources, both Bend Don't Break and Self-Compassion, are online versions where you can download the booklet. Then there's clips to guide you through the work. Now, it's not e-learning, they're visual clips like this that will bring you through both entire booklets. Now, where are they? They're on a search website. So you go on the search website, they're a charity up in Lisburn, and you go up and there's a heading up there, you go up to the resource hub, drop that down to where it says self-help. Both resources are there. Now, the only thing we will ask, if you do use it, even if you only use it a bit, there's an evaluation link on that each clip. So please use that evaluation, because how are we going to know if it's helpful unless you tell us? So those resources are there for you if you choose to. And I hope you do, because a lot of people right now across Northern Ireland are finding these two resources very helpful. So there is light at the end of the tunnel. We're going to continue working with the Lonliness Steering Group to bring training, resources, opportunities, create champions. There's a lot more work to do. But human connection, well, it's as complex as it is vital. So we are hoping these resources we've talked about today, self-compassion and Bend Don't Break, could be helpful and could be part of how we all work together to reduce loneliness. Well, thank you very much for tuning into this clip. We purposely kept it short, and we'll go out and during Loneliness Awareness Week. We hope it does, but it could be used at any time, because loneliness sadly is here. We have to work together to tackle it. Now, if you want more information on loneliness or get involved, contact us. And there's an email address, healthdevelopment@setrust.hscni.net. So thank you very much for tuning into this clip. I hope you found something helpful in it. Thanks very much.